Working with several people that have been in receipt of the personal health budget, it was really quite eye-opening to see how some individuals really changed, where maybe facility for counselling was limited or what have you. They can actually choose things that really suited them. Instead of maybe going to the gym, physio, they would actually choose gym membership. And to see people develop and grow that way was super. And others with continuing healthcare needs, where maybe somebody with frequent hospital admissions, in receipt of a really bespoke, personalised health budget, had care which kept them individualistic, care that kept them safely at home in an environment that they could have an impact on, and in a way that really managed to keep them not just happy with life, but really better. I think there'll be a lot of GPs maybe thinking personal health budgets are just one extra burden too many. And they might well be trying to find ways to roll back the 2014 deadline. And that's probably no disrespect, it's probably a reflection of just all the work they've got to try and get to grips with. However, I think personal health budgets offer a really good way of helping people who really and truly at the moment are not really going to get better because of their long-term condition, who possibly are really using NHS services and maybe unscheduled care services to a higher level. And personal health budgets, by being bespoke, can really help to meet their needs probably more directly, which is far better for the individual with a long-term condition and better for the health economy. So I think PHBs win all round, really. We do try, I think, as doctors, to try and cure all ills, and it does give an opportunity for us to provide holistic care, and so that if somebody has a need that maybe a tablet or a prescription doesn't meet, it really helps us to have an extra tool in our bag to offer that individual. I think there needs to be detail about block contracts, there needs to be detail about brokerage, who arranges this with the individual. But if that can be streamlined and worked through, and I do believe the pilots are well on the way to doing that, if there's somebody who has got complex needs, and there's a GP who really is at the end of what their normal resources can do, it's a super new tool that they can use that can make really a very significant impact to that individual's life. I think if they see it work on one or two people, they will realise that yes, it is safe, the checks and balances do work, and the result in the individual's lives speaks volumes. And then they can think of other people who they are looking after, who the situation where the package at the moment is probably too square a shape for one or two curves, and that maybe they need to have adjustment there. And I think it offers a very good way of helping them. And so experience with one or two, I think it will snowball. And I think once it becomes more in the mindset of GPs, that it's actually going to be an easier barrier than is actually probably considered at the moment by some. It's going to become quite normal, really. We've lived, haven't we, through quite a few different ages where we thought science can cure all. But now we are living in an individualistic society, and that's the way it is. And there probably are very good values and benefits from that. And I think this is a very, very natural progression to that. The National Service Framework in 2005 for long-term conditions, one of its aspirations was that actually people should have joined-up health and social care provided, and be promoted and promote as much individual choice as possible. And I think actually this is really just following that plan, and it's the way we're going, and I think it's a very useful tool for GPs to call upon to meet that need.